Popliteal fossa. Presentation by Group 621 to 630. Shape boundaries diamond intermuscular space 3 upper lateral 1 biceps femoris 2 upper medial 2 semitendinosus 3 semimembranosus 1 5 4 medial head of gastrocnemius lower medial 4 6 lower lateral 5 plantari 6 lateral head of gastrocnemius. Shape boundaries floor 1 popliteal surface of femur 2 back of the capsule of knee joint 3 popliteus muscle and fascia 3 vertical sectional view 1 posterior cutaneous nerve of thigh. Shape boundaries floor roof skin superficial fascia end of small saphenous vein medial cutaneous nerves of thigh lateral cutaneous nerves of calf deep fascia pierced by 1 posterior cutaneous nerve of thigh 1 2 small saphenous vein. Shape boundaries floor roof contents in addition to diagram. Genicular branch of posterior division of obturator nerve. Popliteal lymph nodes. Popliteal fat. Contents to be discussed. Popliteal artery. Popliteal vein. Lateral popliteal nerve. Medial popliteal nerve. Contents to be discussed. Popliteal artery. Popliteal artery floor of the fossa origin termination. Continuation of femoral artery. Termination. Course and relations. Deepest structure in the popliteal fossa. Deep relations. Floor of the fossa. Passes downward and laterally from the upper medial boundary of the fossa downward to the inferior angle. Superficial relations. Upper, semimembranosus. Middle, medial popliteal N and popliteal V. Lower, gastrocnemius. Popliteal artery branches muscular genicular sural terminal. Hamstrings and calf. Superior medial and lateral. Anterior and posterior tibial. Inferior medial and lateral. Middle. Anastomosis around knee joint. 1 genicular branches of popliteal artery. 2 branches from femoral artery. 3 branches from anti and post-tibial arteries. Contents to be discussed. Popliteal artery. Popliteal vein. Small saphenous vein 5 genicular veins muscular veins. Popliteal vein. Origin. At lower border of popliteus by veni comitans of ant and post-tibial A. Termination. Continuous femoral V. Tributaries. Small saphenous vein 5 genicular veins muscular veins. Contents to be discussed lateral popliteal nerve. Popliteal artery. Popliteal vein. Lateral popliteal nerve. Lateral popliteal nerve, common peroneal nerve. L4,5 and S1,2. Origin. Lateral and smaller of the 2 terminal branches of sciatic nerve. Course and relations. 1 enter fossa through its upper angiolateral to medial popliteal N. Termination. 2 descend downward laterally along medial border of biceps femoris muscle. 3 leave fossa through lateral angle. 4 descend behind head of fibula curve around its neck inside substance of peroneus longus muscle. Lateral popliteal nerve, common peroneal nerve. Branches. L4,5 and S1,2. Lateral popliteal nerve. Cutaneous. Articular. Sural communicating nerve. Superior lateral genicular. Lateral cutaneous nerve of the calf. Inferior lateral genicular. Recurrent genicular. Arise near end of the nerve, pierce upper part of tibialis anterior. Muscular. Ascend through substance of extensor digitorum longus. No muscular branches in the fossa. Supply short head of biceps femoris in the back of the thigh. Contents to be discussed. Popliteal artery. Popliteal vein. Lateral popliteal nerve. Medial popliteal nerve. Medial popliteal nerve, tibial nerve. L4,5 and S1,2,3. Origin. Medial terminal branch of sciatic nerve. Termination. Course. Become posterior tibial nerve. Relation with vessels, lateral superficial medial. Coverings, upper part, hamstring, lower part, gastrocnemius. Enter through upper angle. Most superficial structure. Leave through lower angle, medial popliteal nerve, tibial nerve. Branches. Tibial nerve. Articular. Muscular. To knee joint. Superior medial, inferior medial, middle genicular nerves. Cutaneous. Sural nerve. Sural nerve. Descends in the groove between two heads of gastrocnemius by short saphenous nerve. In the lower 1/3 of the leg, it is joined by the sural communicating branch of lateral popliteal nerve. It runs behind and below the lateral malleolus, then forward along the lateral border of the foot. It supplies the skin of the lower 1/3 of the back of the leg and lateral border of the foot and little toe.